CEN Test Prep Exam Date 2023. Question 1. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes Option A. Hypertension, bradycardia, headache. Option B. Abdominal pain, hypotension, and a pulsatile mass. Option C. Fever, chills, flank pain. Option D. Dysuria, frequency, urgency. The correct answer is option B. Abdominal pain, hypotension, and a pulsatile mass. Question 2. In the Emergency Severity Index (ESI) 5- level triage system, a patient who is confused, lethargic, and has a respiratory rate of 8 would be classified as Option A. TSI Level 1. Option B. TSI Level 2. Option C. TSI Level 3. Option D. TSI Level 4. The correct answer is option A. ESI Level 1. Question 3. Hepatitis A is primarily transmitted via Option A. Blood and body fluids. Option B. Fecal-oral route. Option C. Sexual contact. Option D. Contaminated needles. The correct answer is option B. Fecal-oral route. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to Option A. Insert a urinary catheter immediately. Option B. Perform a retrograde urethrogram before catheter insertion. Option C. Irrigate the bladder with normal saline. Option D. Prepare for suprapubic catheter. The correct answer is option B. Perform a retrograde urethrogram before catheter insertion. Question 5. The preferred medication for rate control in a patient with atrial fibrillation and rapid ventricular response who has heart failure with reduced ejection fraction is Option A. Diltiazem. Option B. Verapamil. Option C. Metoprolol. Option D. Digoxin. The correct answer is option D. Digoxin. Question 6. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents Option A. Uncompensated respiratory acidosis. Option B. Compensated respiratory acidosis. Option C. Uncompensated metabolic acidosis. Option D. Compensated metabolic acidosis. The correct answer is option A. Uncompensated respiratory acidosis. Question 7. A patient presents with sudden onset pleuritic chest pain and shortness of breath. The nurse notes decreased breath sounds on the right, tracheal deviation to the left, and hyperresonance to percussion on the right. The priority intervention is Option A. Obtain a stat chest X-ray. Option B. A needle decompression at the right second intercostal space. Option C. Administer albuterol nebulizer. Option D. Prepare for intubation. The correct answer is option B. Needle decompression at the right second intercostal space. Question 8. Carbon monoxide poisoning leads to hypoxia primarily by Option A. Causing bronchospasm. Option B. Binding to hemoglobin with higher affinity than oxygen. Option C. Destroying lung parenchyma. Option D. Causing pulmonary edema. The correct answer is option B. Binding to hemoglobin with higher affinity than oxygen. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with a spinal cord injury at T1 is bradycardic and hypotensive. This is characteristic of Option A. Hemorrhagic shock. Option B. Cardiogenic shock. Option C. Neurogenic shock. Option D. Septic shock. The correct answer is option C. Neurogenic shock. Question 10. Which finding is consistent with an anterior shoulder dislocation? Option A. Arm held in internal rotation and adduction. Option B. Arm held in external rotation and slight abduction. Option C. Patient unable to flex the elbow. Option D. Numbness of the medial forearm. The correct answer is option B. Arm held in external rotation and slight abduction. Question 11. The most effective method to control severe bleeding from an extremity wound is option A. Elevation. Option B. Direct pressure. Option C. Pressure point compression. Option D. Ice application. The correct answer is option B. Direct pressure. Question 12. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A. A neurological status. Option B. A renal function and urine output. Option C. Skin integrity. Option D. Cardiac rhythm and rate. The correct answer is option B. Renal function and urine output. Question 13. What is the priority intervention for a patient with an open fracture? Option A. Immediate surgical debridement. Option B. Apply traction. Option C. Cover the wound with a sterile saline-moistened dressing and immobilize. Option D. Administer analgesics. The correct answer is option C. Cover the wound with a sterile saline-moistened dressing and immobilize. Question 14. Sengstaken-Blakemore tube placement is used as a temporizing measure for bleeding from option A. Peptic ulcer. Option B. Esophageal varices. Option C. Diverticulosis. Option D. Aortoenteric fistula. The correct answer is option B. Esophageal varices. Question 15. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 16. A 25-year-old female presents with sudden, severe unilateral lower abdominal pain and vaginal spotting. She has an IUD. The nurse's priority is option A. Obtain a urine pregnancy test. Option B. Administer pain medication. Option C. Prepare for pelvic exam only. Option D. Discharge with follow-up. The correct answer is option A. Obtain a urine pregnancy test. Question 17. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A. Hypovolemic shock. Option B. Distributive shock. Option C. Cardiogenic shock. Option D. Neurogenic shock. The correct answer is option C. Cardiogenic shock. Question 18. Which assessment finding is consistent with a flail chest? Option A. A crepitus over the sternum. Option B. Paradoxical chest wall movement. Option C. A tracheal deviation. Option D. Subcutaneous emphysema. The correct answer is option B. Paradoxical chest wall movement. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide minus complex tachycardia at 220 bpm. What is the priority intervention? Option A. Administer amiodarone 300 mg for push. Option B. A synchronized cardioversion at 100 J. Option C. Immediate high minus quality CPR and defibrillation. Option D. A transcutaneous pacing. The correct answer is option C. Immediate high minus quality CPR and defibrillation. Question 20. When receiving a verbal or telephone order in an emergency, the nurse should option A. Carry out the order immediately without verification. Option B. Write it down and read it back to the provider for verification. Option C. Ask another nurse to take the order. Option D. Refuse to take verbal orders. The correct answer is option B. Write it down and read it back to the provider for verification. Question 21. A patient presents with sudden minus onset worst headache of my life. The nurse's first priority is option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-minus contrast CT scan of the head. The correct answer is option D. Obtain a non-minus contrast CT scan of the head. Question 22. A hyphema involves option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 23. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, a wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. Question 24. A patient with a history of atrial fibrillation who is not on anticoagulation presents with acute minus onset right leg pain, pallor, and absent pulses. The nurse suspects option A, deep vein thrombosis. Option B, acute arterial occlusion. Option C, cellulitis. Option D, compartment syndrome. The correct answer is option B, acute arterial occlusion. Question 25. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from option A, peptic ulcer. Option B, esophageal varices. Option C, a hemorrhoids. Option D, Mallory-Weiss-Tear. The correct answer is option B, esophageal varices.